Welcome to Chapter 30, Nursing Management of Patients with Diabetes. Diabetes is characterized by elevated levels of glucose in the blood, hyperglycemia. It affects many body systems and has major physical, social, and economic consequences. The leading cause of non-traumatic amputations, blindness in working adults, and end-stage renal disease, and we have not been able to manage this disease for quite a period of time. Diabetes affects nearly 24 million people in the United States, and costs related to diabetes are estimated to be $174 billion annually. The pathophysiology of diabetes, there are two types, type 1 and type 2. Type 1 diabetes is characterized by destruction of the pancreatic beta cells, and it results in decreased insulin production, unchecked glucose production by the liver, and fasting hyperglycemia. Type 2 diabetes, the main problems are insulin resistance and impaired insulin secretion. Gestational diabetes, which is another type of diabetes, is any degree of glucose intolerance during or with the onset of pregnancy. Risk factors for diabetes are family history, obesity, a BMI of greater than 25 kilograms per meter squared, ethnicity, African Americans, Latino, Native American, Asian American, and Pacific Islanders, age greater than 45 years, previous impaired glucose tolerance fasting glucose, hypertension with a blood pressure of greater than 140/90, high-density lipoprotein or HDL cholesterol levels, and history of gestational diabetes or deliveries of babies that are over 9 pounds in weight. Which of the following risk factors for diabetes would a nurse identify as being modifiable? B, the patient is moderately obese. Clinical manifestations and things that you will see in your patients and assessment include the classic clinical manifestations of diabetes, which are your 3 Ps, polyuria, polydipsia, polyphagia. Polyuria means increased urine output, polydipsia means increased thirst, and polyphagia means increase in hunger. Other symptoms and clinical manifestations of diabetes include dehydration, weight loss, fatigue and weakness, vision changes, tingling or numbness in the feet and hands, dry skin, skin lesions, or wounds that are slow to heal, or recurrent infections. Abnormally high blood glucose levels are the basic criterion for the diagnosis of diabetes. Diabetes management, nutrition, and exercise. The goals of diabetes management are control of caloric intake for a healthy body weight, control of blood glucose levels, and normalization of lipids and blood pressure in the patient. Consistency in the amount of calories and carbohydrates ingested at each meal is essential. You must also be balanced against fat and protein intake according to a defined food classification system. Exercise is vital in managing diabetes as it helps in weight reduction and cholesterol management. Self-monitoring of blood glucose, or SMBG, is critical in diabetes management. It allows for detection and prevention of hypoglycemia and hyperglycemia. Various methods for self-monitoring of blood glucose are available and should be used frequently. Glycated hemoglobin levels reflect average blood glucose levels over a period of approximately 2 to 3 months. Your hemoglobin A1C normal is 4.5 to 7. Urine testing for ketones and glucose may also be performed for the patient. Is the following statement true or false? A patient's glycated hemoglobin level, or hemoglobin A1C, has found to be significantly elevated. This indicates that the patient has been experiencing wide fluctuations in blood glucose levels. False. A patient's glycated hemoglobin level indicates average blood glucose level over the previous several weeks, but it does not indicate the range of the levels. Diabetes management, insulin and medications. Insulins may be rapid-acting, short-acting, intermediate-acting, or long-acting, and insulin regimens vary from 1 to 4 injections per day. Insulin is usually self-administered by the patient and must be correctly administered in an inpatient setting as the nurse monitors the patient and teaches the patient about the correct way to administer insulin. Complications of insulin use need to be monitored, and oftentimes insulin pumps are appropriate for some patients as they provide a basal amount of insulin. Multiple oral anti-hyperglycemics are also available, and we'll talk about those in the next PowerPoint. When caring for a hospital patient who requires insulin injections, the nurse should A. Use the same injection site for all the injections needed during the day. B. Store insulin vials in a warm, dark, dry place. C. Use a 3 to 5 milliliter syringe. Or D. Mix rapid-acting and long-acting insulins in the same syringe. Answer D. When rapid or short-acting insulins are given with longer-acting insulins, they are usually mixed together in the same syringe. Injection sites should be rotated, and insulin should be stored in a refrigerator until the time the vial is opened. Insulin syringes range in size from 0.3 milliliters to 1 milliliter in size. Nursing management of diabetes. Nursing management of diabetes requires a comprehensive plan that addresses multiple factors for the patient. Extensive patient education is necessary, and it should address pathophysiology, treatments, potential complications, and practical considerations. A systematic teaching process needs to be followed in these patients. Complications of diabetes. Hypoglycemia. Hypoglycemia is a blood glucose less than 50 to 60 milligrams per deciliter. It can be caused by too much insulin or too many oral hypoglycemic agents or high doses of them, too little food intake by the patient, or excessive physical activity such as exercise or strenuous work on the part of the patient. Signs of hypoglycemia include inability to concentrate, headache, lightheadedness, confusion, memory lapses, numbness of the lips and tongue, slurred speech, impaired coordination, emotional changes, irrational or combative behavior, double vision, and drowsiness. Hypoglycemia is usually treated with 15 grams of a fast-acting concentrated source of carbohydrate, such as orange juice, but needs to be followed with some type of protein, such as cheese and crackers or peanut butter. Glucagon IV may be required in severe cases of hypoglycemia for management. Other complications of diabetes include diabetic ketoacidosis, or DKA. Diabetic ketoacidosis is a deficit of insulin that results in disorders in the metabolism of carbohydrates, proteins, and fats. It ultimately results in ketosis and metabolic acidosis. The patient's urine and serum ketones will be elevated, and ABGs will reveal a metabolic acidosis. Also, oftentimes, a lactic acid is ordered to see the circulating amount of lactic acid in the serum. Management of DKA is directed toward correcting dehydration, electrolyte loss, and acidosis, and managing elevations in blood sugars appropriately. Complications of diabetes: hyperglycemic hyperosmolar non-ketotic syndrome, HHNS. HHNS is characterized by a hyperosmolality of greater than 340 milliosmoliters per millios's per liter in the serum, and hyperglycemia of greater than 600 milligrams per deciliter. It is important to note that in HHNS, oftentimes the blood sugar will be much, much higher than in a diabetic ketoacidosis patient. Oftentimes they'll present with sugars from 800 to 1200 milligrams per deciliter. And also they present with alterations in level of consciousness. Manifestations include hypotension, profound dehydration, such as dry mucous membranes, poor skin turgor, and tachycardia, and variable neurologic signs. It is important in these patients to make sure you're assessing their neurologic status, assessing all of a complete head-to-toe assessment on these people, as they're critical. Treating HHNS consists of IV fluid replacement, correction of electrolyte imbalances, particularly potassium, and insulin administration. Nursing care includes close monitoring of vital signs, fluid status, and laboratory values. Remember, with hyperosmolality, when they're high, they're dry. And these patients will not present with elevations in serum and urine ketones, such as in patients with diabetic ketoacidosis. Also, keeping in mind that in both patients, you may have some degree of initial hyperkalemia, and that the potassium will move back into the cell as the blood sugar comes down. So it's important to be monitoring not only their blood sugars hourly, but their potassiums. When the patient reaches 200 milligrams per deciliter for a blood sugar, then it's oftentimes at that time that you may turn the insulin drip off and then start a bag of D5 water to try and make sure that you prevent rebound hypoglycemia. Is the following statement true or false? Patients with type 2 diabetes are more susceptible to DKA and HHNS than are patients with type 1 diabetes. False. DKA and HHNS are primarily associated with type 1 diabetes. Both ultimately result from an absence of insulin, and both ultimately result in profound hyperglycemia. Long-term complications of diabetes. There are several different types of long-term complications of diabetes in patients who are unmanaged in their disease. Diabetic macrovasculature or microangiopathy complications include blood vessel walls that thicken, sclerose, and become occluded by plaque that adheres to the vessel walls. This leads to coronary artery disease, cerebral vascular disease such as stroke, and peripheral vascular disease and hypertension. Focus of management is aggressive modification and reduction of risk factors in these patients, and making sure that you're monitoring their cardiac status, their cerebral vascular status, their peripheral vascular status, their blood pressure, and their skin. Other long-term complications of diabetes are diabetic retinopathy. One of the leading causes of blindness in the United States is diabetic retinopathy. Diabetic neuropathy, such as peripheral neuropathy and autonomic neuropathy, and diabetic nephropathy, or renal failure. Diabetic neuropathy often produces complications in the feet and legs of venous stasis ulcers, cellulitis, and other types of problems. Diabetic nephropathy leads to kidney failure and oftentimes dialysis. In an effort to prevent foot and leg complications of diabetes, what measures should the nurse recommend to a patient with recently diagnosed type 1 diabetes? A. Daily inspection of all surfaces of the feet. B. Wearing tight shoes with good arch support. C. Cutting toenails daily. Or D. Avoid walking whenever necessary. Answer D. Daily inspection of all surfaces of the feet is critical to identify wounds early, and patients with diabetes should be encouraged to begin the habit of thoroughly inspecting feet on a daily basis. Tight shoes and frequent cutting of the toenails can increase the risk of foot ulcers and should be avoided, and exercise should be encouraged in the diabetic patient. Special issues in diabetic care. Surgery creates special risks for patients with diabetes. Hospitalization creates a potential for unstable blood sugar levels. In addition to nursing assessment for the primary problem, assessment of the patient with diabetes must focus on managing hypoglycemia and hyperglycemia, skin assessment, and diabetes self-care skills. The goals and interventions address improved nutritional status, maintenance of skin integrity, the ability to perform basic diabetic self-care skills, and prevention of care for the avoidance of chronic complications of diabetes.